Here now is Hadley Heath Manning, Independent Women's Foreign Policy Director. So part of the cost issue is that millions of people who have good-paying jobs that they like would no longer be employed. What do you think about that? She's willing to admit that, so it means if she's willing to admit 2 million, it's probably a much bigger number.
Oh, I think it's certainly going to be a much bigger number because this study is just looking at administrative jobs in healthcare. It's not looking at the broader impact on the economy that the increased tax burden of Medicare for All would manifest. But I have to agree with Elizabeth Warren on one point, and that is that we do have administrative costs in healthcare that are unnecessarily large, in large part due to the fact that our healthcare system is responding to overregulation. It's responding to a very complex billing and pricing procedures that are simply unnecessary. If healthcare were more market-driven, we would see clearer prices and we'd have more competition, and that would get rid of administrative waste. On the other hand, what Elizabeth Warren is really admitting here is that her plan would totally wipe out the private health insurance industry. And of course, that costs a lot of jobs. Some of those people might be absorbed into a government program. We're going to see a lot more government jobs to administer this thing.
So that's exactly where I was going to go next, is that she will say, I'm sure, that there will be more jobs just in the government. And that is really a defining principle of so many of these plans, is that you give the government control. Everybody gets everything from the government. They're giving you your health care. And then also, if you want a job, you're going to go work for the government. What do you think about that?
Well, it's socialized medicine. It's socialism in healthcare. It's the government running healthcare rather than the private sector running healthcare. And I get that the simplicity of that is appealing to some people, because what we have today in our healthcare marketplace is very broken. People are frustrated with the lack of choices they have. Many people work for an employer that provides a health insurance plan that they might like, but it wasn't the plan that they chose. About 80% of employers who offer a health insurance plan give you one option. They don't give their workers an option of health insurance plan. And then you don't get to choose which hospital you go to or which doctor you see because you're restricted to an insurance network. So we don't have a very free system in healthcare today. But replacing it with one government option is certainly not going to increase the choices that people have, certainly not going to increase market competition. It may depress costs, but remember, the only tool that the government has to reduce costs is to pay providers less. And when we pay providers less, that's a backdoor style of rationing, which means they're going to be less willing to offer those services to patients who have a real need. And that's the ultimate cost of Medicare for All. It's not just the dollar amount.
Well, it becomes, when they say that it's going to be a more fair system where everybody has a right to health care, actually it becomes more of a two-tiered system where you have the people who must, get their health care from the government, and they may wait years for things that they need. And then you have people who have cash who will just go outside the system and will buy better quality, faster health care. So will result in a system that is so much more divided than what there is today. And if you want everybody working for the government, I mean, I don't know, it's Halloween. Do you see a lot of kids out there? When I grow up, I want to work for the IRS. I mean, I don't see a lot of kids out there in IRS costumes. It seems like I want to be a government bureaucrat when I grow up. It is not what our nation has kind of aspired to.
Well, importantly, Medicare for All might be able to ensure everyone a right to health coverage. It might provide you with a certificate or a card that says you're covered by Medicare, but it doesn't ensure a right to health care. The government cannot provide the actual services to people. It can't change anything about the realities of supply and demand in healthcare. People are going to need healthcare when they need it. And the question for Americans at this juncture is, what do we think will provide that better, a freer marketplace or a government program?
Yeah, and if you end up paying people less, how many people will go into that field? Will they be there with the quality to provide it or not? Hadley, thank you. Appreciate it.